Looking at today's health headlines, measles cases are on the rise. The Centers for Disease Control and Prevention have reported 58 measles cases in 17 states since March. The virus is so contagious, medical experts warn it can stay in the air for 2 hours after the infected person has left the area. Symptoms for measles include high fever, cough, runny nose, watery eyes, and a rash that starts on the face and spreads to the rest of the body. Federal health authorities say the best way to prevent and stop the spread of measles is by getting immunized. More than 1 out of every 10 Americans suffer from food allergies. Researchers surveyed more than 40,000 adults in the U.S. and found the 3 most common allergies are shellfish, milk, and peanuts. Half of those that reported having an allergy described their particular food allergy as being severe. Around half of the participants said they didn't develop their allergy until they were adults. Your arteries may be able to tell if you're getting enough sleep at night. Researchers say fewer than 6 hours or waking frequently increases your risk of damaging plaque building in your arteries. This slows blood flow, putting you in danger of a stroke, heart disease, and other complications. And finally, older women who regularly eat fried food have an 8% higher risk of death than those who don't. Findings show it affects women ages 50 to 65 who eat 1 or more servings of fried food a day. This week, we recognize a healthcare hero who dedicates her time and energy to training the next generation of nurses here in the Valley. Alexis Ramirez is the Director of Nursing for Academic Services at Community. She says even as a young girl, she knew she wanted to go into the medical field to help people.
If you asked me at 8 years old, I would have told you I'm going to be a cardiothoracic surgeon.
But as she got older, her dreams of being a surgeon morphed into becoming a nurse, and it was a perfect fit.
As a nurse, I was able to have such an impact during my shift, multiple days a week, but I still was able to have my work-life balance.
After working as a registered nurse for several years, Ramirez realized her true calling was teaching and helping her peers grow in their careers.
I love to grow people, and so staff development just seemed to follow naturally after that.
Ramirez has trained nurses across community health system facilities, including Clovis Community, Community Regional, and Fresno Heart and Surgical, where Chief Nursing Officer Heather Rodriguez says she helped establish a solid training ground.
Alexis is such an optimistic, upbeat individual. She has been hip to hip with a lot of training that nurses respect her and she respects them. I think that's key.
Ramirez also serves as the Director of Nursing Academic Services with Unitech College. That community recently partnered with to help strengthen the California nursing workforce and offer wider access to overfull nursing programs.
They come in with a problem, you're able to help them deliver nursing care that's highest quality. And then I think the moment that is the greatest is when they come back and they're looking for you and they give you a big old hug and they're just like, thank you. You know, you prayed for me while I was scared, you took care of me afterwards, and you encouraged me through that process. So that to me is the most rewarding part of it.